Good evening and welcome back to blackdoctor.org. Tonight's discussion is once again our community immunity, and tonight we are in Florida. And in case you didn't know, Florida was one of the hot spots, but now they are averaging about 1,544 average daily new cases, and this is in the last 7 days. So that is definitely things are getting better. And we are going to speak to one of the Florida's finest pharmacists, and she is going to tell us about the numbers as far as the vaccine distribution and stuff. But first, I would like to share with you that in the country right now, in the United States, there have been 33,530,304 confirmed cases, with unfortunately 600,676 total deaths due to COVID 19. And this week, 1,938 deaths. So things have fallen, 28% decrease since last week. So things are getting better. Vaccines are getting out there, and we are seeing people who do get COVID, but they are having a much suppressed comparison to other people that had COVID and didn't have the vaccine. So they're not having to be hospitalized and they're surviving. So, first up, we have Dexter Bridgman.
Good evening.
Good evening. Thank you so much for joining us this evening.
It is
So,
indeed my pleasure. Thank you for having me.
oh, awesome. Thank you. So, please tell us about your experience with COVID, personal experience with COVID, and then we will talk about business in Florida right now.
Yeah. Well, I had COVID May, June, and couldn't have been at the worst time. I was getting married, and my fiance and I bought a home together. And unfortunately, because of COVID, I could not help her move. So she still talks about that today, and
You did that
and
on
nudges
purpose.
me
I'm
every
with
now
her.
and
I'm with
then.
her. You did that
Yeah.
on purpose.
She had to do the entire move herself. I felt really, really bad, but there's nothing I could do. It was a horrible experience. I would say on a scale of 1 to 10, I was probably a 3 or a 4. But that 3 or 4 was enough to take off 25 pounds. I had atrophy, lost all kind of muscle. Not that I was a He-Man, but I mean, it was amazing because all I could do was lay down for 2 to 3 weeks. Just getting up and going to the bathroom seemed like I just ran a New York marathon or something like that. It was crazy. Total lack of energy and trouble breathing. All the
Did you
symptoms.
have to go to the hospital?
I didn't have to go to the
Oh, good.
hospital. Thank God for that. I didn't have any deep respiratory issues. Breathing was a challenge. Definitely did not have a sense of taste or smell. But I thank my lucky stars because it could have been a lot worse.
Hmm.
Obviously, there are people who are dying, people who experienced a lot worse than I did. So I got off kind of easy.
So how long would you say your course was?
I would say the toughest part was about a 2 month part, but I think it lasted about a month,
Okay.
where it took me some time to get my strength back. When I say my strength, I'm talking about being able to lift things without, we take things for granted
Right.
in terms of being able to do this and that and the other. Then all of a sudden, because I had no muscle tone. That was the shocking part. That was the shocking, most shocking, is to see your body and how quickly that it can just
Yeah.
disappear. I had no. I mean, I'm not a medical person. I had no clue that your body could atrophy that quickly.
Hmm.
You know, so I would say in totality, a little over a month.
Oh,
It took
wow.
me a little over a month to truly get back to form.
Got you. Got you. So I hope it didn't postpone the wedding.
Well, yes, it did. It did. We did not have a wedding. I mean, we did end up getting married, but not the way we had intended. When we did end up getting married and on Thanksgiving weekend, because our certificate of marriage
Was
was
going to
getting ready to
expire.
expire the following week. So we hurriedly got married in our house with with her mother, her son, my sister, her husband, and the officiant. 6 people in
Got it.
November.
Got it.
So we were going to get married under the Brooklyn Bridge, and she's a New Yorker, I'm a New Yorker, and have
Yeah.
family and friends and all that type of stuff. And big wedding, none of that, none of that.
You'll
We
have a
saved,
big party.
well, we saved a bunch of money. How about
This
that?
is true. This is true. This is true. Well, congratulations.
Thank
So,
you, thank you.
can you speak to? Are you in Miami?
Yes, I'm in South
Okay.
Florida. I'm,
South.
I'm not. Well, I'm actually technically in Broward County,
Okay.
but yeah.
So, can you speak to business in Florida? Because I mean, Florida was one of the last ones to kind of shut things down, and
Well, I mean, Florida and certainly South Florida is we don't have a lot of corporations that are
right,
located here. So what fuels the economy is tourism. Okay, so we had to open up quickly. I think we were one of the first ones to open up actually
hmm
because we needed those tourism dollars. So even for New Year's night, I remember there was the big party, but it was over at 1 o'clock. It was over at 1 a.m. It was at this famous hotel on South Beach, but it was over at 1 o'clock. So most people are leaving their homes at 1 or 2 o'clock in the morning. They get their hotel, the party's over with. But yeah, it's interesting because even to last week, I was on South Beach, Miami Beach. I was staying there for about 4 days for a big birthday party. Some friends came from out of town celebrating a friend's 60th birthday party. And one of the things I noticed is that service was slow. And when I said, "What's going on at this restaurant?" they said, "Sir, we can't get anybody to work."
yeah, that
And
seems to be
that's a
going across
major,
the
major
country.
issue. That's
Yeah,
a major issue, especially when again you're in an area where tourism is all that fuels your economy, and you can't find people to work the restaurants, to work in a hotel, to work the front desk, to work the bellhop, to work the valet. None of that.
hmm
None of that. You know. So but things are coming back to normal. I would say slowly but surely, people are starting to go back to work. I think companies and corporations have realized that they can be just as effective and just
yeah,
as you know um,
productive.
productive. Thank you. Just as productive working from home.
Yeah,
My wife works from home and they get a lot out of her. She starts her morning at 7 o'clock, doesn't leave her computer until like 6 o'clock, as opposed to if she went at the
you'd
office
have to
being nine to
commute.
five.
hmm
So companies are definitely opening up, and people are going back to work. In terms of what I do, I'm in media, and advertisers are starting to advertise again. And I think if I was a person that could predict the future, I would say I think things in this country would, especially, well, I can't speak for the entire country, but certainly speaking for South Florida, I think will be business as usual. I think at summer. I think at the end of the summer, early fall. I
Okay.
really do.
Okay. Okay. Yeah, I think a lot of businesses have realized that they can have a hybrid model where people can come to the office sometimes, but they don't have to every single day. And they're very thankful that they can get people to be so productive because you cut out
Right.
that commute. That commute. There's some people that spend hours in their cars
That's
daily,
right. That's right. That's right. And
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 it,
and
you
Florida
can't get
traffic
anything
is
done.
notorious.
Right, just like Chicago's is. And but
Very
at least
true.
we do have public transportation. Good old L and the
My public
CTA.
transportation is not very good here.
Yeah, well, that's like I said, Chicago and New York are two places that really
Yeah,
know how to do public transportation. So
they sure do. They sure do. They
But
sure do.
yeah, so it's a good thing that I think that, a lot of people, it's very stressful having to drive and be in traffic. So I think that that's going to help people's morale because they get to stay home a little bit more. And it'll be very interesting, but I do believe that a lot of the places across the country will be back to normal by the end of the summer.
Oh, absolutely.
Yeah.
I definitely believe that to be true.
And
I
people
definitely
looking
believe
for
it.
jobs, these people are giving all sorts of bonuses to hire you. So I'm telling you,
Yeah.
they need to jump on board.
Yeah, yeah. I mean, on 95, they have all these billboards. A lot of the hotels, a lot of the casinos, they're doing job fairs for, cooks and, cooks and cleaners and every
Yeah.
imaginable position. Every time you look around, there's a job fair going on.
Hmm.
So, if you- if you want to work, you can find a job.
Yeah.
You can
And they
definitely
have to
find a
be
job.
competitive too now too. So, it's more than the, more than minimum wage
Yeah,
for
yeah.
places that used to be minimum wage because they have to be competitive because it's so many jobs out there.
Yes, definitely true. And I know in Miami-Dade County, and certainly in the living wage is about 12 and change an hour, and most of these jobs are paying $15 an hour to start.
Right. Exactly.
You know,
Exactly.
so again, if you're not working, it's because you don't want to. I mean, obviously, we're talking about some jobs that are, when I say, I don't want to say lower level jobs or anything of that
Right.
nature, but of course, there are the skill jobs and the professional jobs that are also, many of those positions are also available as
Right.
well.
Because there are some people that are not going to go back to the office
That's
because they
right.
don't want
That's
to.
right. That's right.
So,
That's right.
so we'll come back to you. Next, we
Okay.
have Dr. Cassandra Esperon. Hi. Uh-oh. She's on mute.
You
Okay.
pronounced my name perfectly. Thank
Thank
you for
you.
that, Dr. Renee.
That was work. I worked on that. So, can you please? I know that you work for the AIDS Healthcare Foundation. So you see a whole lot because COVID affected everyone in different ways, and HIV is obviously human immuno, suppressants. Those people are immunocompromised, so those people definitely one would be affected by COVID horribly. Secondly, needed to be at the top of the list of people to be getting vaccinated. So can you please share with us maybe some numbers with how many people in Florida or in Miami that have been vaccinated?
Yeah, so with HIV, definitely it is a disease that makes you immunocompromised. As long as you're taking your medication, you should be okay, right?
Right.
So it's definitely more important for anybody with comorbidities to get vaccinated. But the latest numbers that I saw for the state of Florida was about 42%, right, of fully vaccinated. It's not the greatest. It's not your Seattle or your San Francisco at
Right.
70%. So we have a lot of work to do in education, right? Because there's so many myths out there regarding the vaccine, right? So it's all about education and empowering people. We're not forcing them, but it's all about education,
Right.
right? So, being a pharmacist on the front lines, every day I would go to work, I would not know what would happen. Imagine your patients are calling you, asking you questions. So, in the beginning, we weren't sure if our HIV patients were, going to be more at risk or not. But, based on the studies, there are similar risks, to
Hmm.
anybody else as long as you're taking your medication. Because as we know, undetectable is untransmittable. What does that mean? That means if someone's taking their medication and they have very little of the virus in their bloodstream, right? They will not transmit it to anybody. So they're living long, healthy lives, and it's just an amazing change. And similar to COVID, because HIV is the other pandemic, right? It's
Right.
kind of forgotten, but it's still
It's
a
still here.
pandemic. It's still
Just like
here.
COVID. Look, just like
Just
COVID in
like
a lot
COVID.
of places, people have forgotten. And then our
Exactly.
guest this past week told us that she admitted 2 pregnant women last week with COVID.
Wow. Yeah, you know what's happening, right? Everybody's stuck together, and a lot of people are in relationships where they may not get along, or there's a lot of intimate partner violence, right? Everybody's stuck inside. There's a lot of things going on when,
Hmm.
we're forced to, stay home and have these restrictions in place. So it's definitely important for people to make sure that they get tested. A lot of these health departments are even offering free testing so they can send the test kits home. So not only get your vaccine and get vaccinated, but also get tested if you can. And I've always thought it would be beneficial for these testing sites to do both. I thought that's a
Right.
really creative idea, and it's definitely very important. If you've never got tested, it's important anybody between the ages of 13 to 65 to at least get tested at least once in your lifetime. It's very important.
Very, very important. I actually just saw in the news the other day in Detroit, they have a large number of teens that are testing positive.
Yes, it's
Yeah.
definitely a major issue. They think they're healthy, they think they're invincible, but it's there's protection, right? You can take a
Hmm.
medication called PrEP, which is pre-exposure prophylaxis. It's either Tivicay, it's either Descovy or Truvada. You take that
Hmm.
medication once a day, and what it does is it prevents HIV. Right, that's pre-exposure. Then there's also post-exposure. Right, think of it as like your Plan B, like
Yeah.
a lady who does not want to get pregnant within 72 hours, she goes to Walgreens and gets her Plan B. Think of it as the Plan B for HIV, which is the post exposure prophylaxis. You take an HIV regimen for 28 days that includes Tivicay and Truvada. Right, so this is super important because we mentioned earlier there's intimate partner violence going on. There's people who get raped. There's people who don't want to speak up. At least you
Hmm.
know that there's something that you can do about it.
Right.
Although it's expensive, there's a lot of resources to pay for it, a lot of help out there. So we can also talk about these other things that are happening in the middle of a pandemic, not only to get vaccinated, but to take care of your mental health and your social issues as well. It's definitely, you know,
Yeah,
a
and a
holistic
lot of things, like
approach.
you said, have come to the forefront that
Yes,
maybe you were ignoring or didn't pay attention to. And because we were stuck together, you know, people have
exactly.
completely, taken a leap of their senses. And so it's definitely important. And it's crazy that you say all of these wonderful drugs because you guys, she said, HIV is the other pandemic. So can you imagine what we could be talking about 10 years from now about COVID? There could be all these drugs to help us with COVID. But thankfully right now we do have a vaccine, and if you please can get yourself educated. Now I think that your population, because I've done another talk with with the HIV positive person, and it seems like there was actually somebody else from AHF, and I think that your population of patients, they seem to be a little more okay with the vaccine.
Yeah, they definitely are. I think it starts with education, right? So we are an advocacy organization, and it's always about empowering the patient with the information. So I'll tell you a personal story. I had a patient who called me and actually questioned me about the vaccine. So I explained to him what it was about and actually was able to convince him, right? It's
Hmm.
all about relationships. I even helped him find a site, and he was super excited. He kept up with me and like told me all his side effects. Again, when you have a close relationship with your patients, and that's the culture at
Yes.
AHF, where you build relationships with the patients. They kind of become part of a family, right? So just one example, right? So if everybody has that same attitude, being open to help navigate the patient through the system, and whatever it is, it's like we are trained to anticipate the patient's needs, right?
Right.
You anticipate the patient's need, and with that being said, you've earned their trust,
Yeah.
right?
And
And
as a
it's
community,
so
as a
vital.
Black community, we need to, if you know and you have information that you know are facts, because we just told you there's a lot of myths out there, but if you know you have facts and somebody in your family, your community comes to you and asks you, please give them the factual information. And if you can, like she said, direct them to where they can go get their vaccine. Vaccines
Exactly.
are free and available for everyone. And, we're almost down to the point that we're going to have the young children under 12 soon. But, for 12 and over, now can all be vaccinated. And we've already seen that most of our elders went and got vaccinated. It's just this little generation behind that and the one behind that one that we're having a little trouble getting vaccinated. But I think a lot of the colleges are going to have some rules that are going to make a lot of younger people get vaccinated because you're not going to be able to come to school.
Right,
Right.
exactly. Like we can not only just think about ourselves, right? So like you could be a carrier and
Right.
healthy and not symptomatic, but then you're around your grandmother or that family member that's has comorbidities such as diabetes or hypertension, and then you have a problem, right? You
Right.
have long haulers and it can even lead to death. So it's we have to think about it as a holistic approach, right? Globally, right?
Yes.
So we have access to all this vaccine, and there's a lot of unused vaccine that's going to expire, and we definitely need to share our vaccines with the world, right? That's definitely
Yes. I
important.
was just going to ask you about that. So please tell us about this, what you guys did recently.
So my organization, the AIDS Healthcare Foundation, on June 10th, we actually went down to the Fort Lauderdale Federal Building and we actually protested. We have an initiative. It's called Share, right? Save, actually, save. So it means share American vaccines with everyone. So we were out there chanting, "Don't be greedy, share the shot." So that was our chant. And, that was our ask because it's definitely important for the lower economic status countries to have access to the vaccine, right? Not only because we, are all human beings and we should care about each other globally, but again, we all travel, right? Like I'm not originally from the US, I'm originally from Haiti, right? And there's a lot of diaspora and people
Yes.
who are traveling. So it does matter what happens to other countries. So
Yes.
it's definitely has to be a global approach, and if you don't get vaccinated for yourself, do it for humanity.
Right. And there's so many people that live in cold climates like we do that the first thing they want to do as soon as, especially once, we had just been inside for so long is they wanted to travel. And because the other countries, like our lovely Caribbean countries were taking people in, and then, their wonderful numbers of getting rid of COVID, all of a sudden we're no longer wonderful.
Exactly, they
And it's
bring in those
because
strains.
exactly. And then people brought it from here. So, and from other countries as well, from the UK and everywhere, other places. But it's so important that we all get vaccinated. And if you don't do it for yourself, like she said, do it for the community immunity, which we're talking
Right.
about tonight. Let's do it for the community immunity so that we can get rid of it. I always have to remind people the reason why you don't know many people that have polio is because they had a polio vaccine and everyone got vaccinated. They developed community immunity and polio like fell off the map. No one heard of anyone getting polio anymore. Same thing with measles, mumps, rubella. All these things, they used to be just a pandemic just very similar to this, but they got a vaccine, people got treated, and that's all we have to do is if we can all get vaccinated, we can get, like our president said, the 70% of us vaccinated, we can really, celebrate Christmas with our families this year. And, for some of us, like we said, that would include us being able to leave the country and being welcomed into the country. Because the other thing about the other countries is at least they did have plans in place. You have to quarantine for 2 weeks, maybe once you get there, and all these things. But if you're vaccinated, I think that they are a little less strict on how long you have to stay in quarantine and stuff. And so it's really important. Now, as far as where you are, what is the distribution like for the vaccine?
So there's a lot of access. So we actually collaborate a lot with the health department. We've done some clinics and a lot of access. We make sure that our patients gets vaccinated. But unfortunately, there seems to be like a disconnect with the communication and you know, you open the clinic and then people don't come and then they come and question. So, it's we maybe need to have like a streamlined national way of getting the message about like one platform where someone can just sign on and sign up because everybody's kind of doing their own little organization in their own corner. I think it's maybe the government can get involved in organizing it a little better. But we have done so many clinics, like on a Saturday, they come out and make sure everybody gets vaccinated, not only our patients, but their friends and family. And we have
Hmm.
opened it to the community. Everybody can try to do their part. But I'm definitely
Right.
part of all the work that my organization has done.
Yeah, definitely. And it's like organizations like the AIDS Healthcare Foundation and churches and, all the faith-based groups, the sororities and fraternities in the Black community, we trust each other first and foremost. So we need to be the ones to say, here, this is okay. I did it already. And so you're right. If we had one thing, because I do know that there is a disconnect when you have to send a text message or maybe you have to go online to apply. Not everyone has internet access.
Exactly.
And so, or they don't know how to navigate it,
Exactly.
So it's really important that we make it very easy. I know where I am, they actually had people going out on foot. And they talked about it all over the news and the radio. This is what they'll be wearing, and these are the qualified people. And they're going on foot, and you can just, on the street, you could end up getting a shot.
That's awesome.
Yeah. So I think that is, things like that are probably things that have to come in place, or else we are, like you said, going to be throwing away a whole lot of shots because they do expire, which is why we should send them to people that need them before they expire. It's just, it doesn't make sense that happens. But when I got my second shot, the first shot, there was a line. The second shot, there was nobody in there.
Really?
Nobody. I just walked in, walked out like in 10 minutes.
So which one are you? Are you a Pfizer princess or a Moderna mama?
I'm a Moderna mama.
I love it.
Yes. And you know what? I didn't, you can't, when your number is up, you're like, oh, thank you. I didn't choose. This is what I got. And I was like, You know what? This was good enough for Dr. Fauci. And it was good enough that Dr. Kizzmekia Corbett, helped, bring this about. I said, well, then I am in good hands. I said, this is fine for me. And actually, I was one of the few lucky people that had no side effects. But
nice.
I was glad to be able to get my shot. And so I think that if people can understand, and we have to have talks like this so people can hear and understand, oh, they're in Florida too. Oh, well, let me, figure out where I can go get my shot. Listen to the right people. BlackDoctor.org is a very reliable source. They've had Dr. Corbett, they've had Dr. Fauci, they've had all these amazing doctors and scientists and pharmacists to talk about this, the people who were involved in the clinical trials to talk about exactly how this came to be and the safety of it and the efficacy of it, because this is like one of the most effective vaccines that have ever been created. And I think people don't even realize that. They don't realize how many of us were actually in the clinical trials, because that is so important for you to understand that they tested this on Black people. And it works, because there's a whole lot of drugs that they take every day. And this is what kills me. People who take pills all day and night who won't go get vaccinated, but you've never asked about your medication. But half of those medications were never tested on anybody that looked like you.
Exactly.
And you're a pharmacist, so I know there are drugs on the market that do not work for us, but work for others.
Oh, yeah.
Yeah. So, and this is something that we see all the time. And so I think it's really important that we understand that we're a part of this one. This one we're a part of. And so we need to make sure that we definitely understand that, so that we can make sure that we're not letting our shot get thrown away. And it's free for everyone. So please understand it's free. Go get your shot. And we will come back to you, Dr. Esperon. Next, we have Monica Harris. Hi, Monica.
Hi, how are you?
I'm good. Thank you so much for joining us.
Absolutely.
So, Monica, please tell us your story about COVID.
So I actually got the vaccine. I got Pfizer. I'm trying to remember when you were talking if I got Pfizer or Moderna. I got Pfizer. It didn't matter.
It didn't matter to me either, right?
It didn't matter to me. I got Pfizer, and actually my husband and I both got it. We have a 5-year-old, and so it was important for us to ensure that we were vaccinated, because he can't get vaccinated.
Right.
And he's had some underlying respiratory issues previously. So we just wanted to be sure that if we're going to work, even though we're wearing a mask and socially distancing, that we weren't accidentally bringing it home with us. So I got the vaccine. The first day, my arm was kind of sore, the first shot. And then I think it was 14 days or 2 weeks after, got the second shot. And I was one of the unfortunate ones that had some side effects.
Okay.
So, and they didn't hit initially. So at first when I got it, obviously I don't like needles, so it was a little painful. But I felt kind of lethargic almost maybe 10, 20 minutes after, 20, 30 minutes after the shot, because they make you wait to 15. They make you wait
15,
to
yep.
15 minutes. It's about 20, 30 minutes after the shot, I felt a little lethargic. And then probably 2 hours later, I was tired, super tired, and started to have a little bit of muscle pain, but I just assumed it was, kind of the virus or whatever's in the shot, kind of doing what it needs to do and my body reacting to it. And so the next day I woke up, I was fine, had to take my dog to the vet. And on the way back, it was really slow, but I felt myself getting a fever. And I was in bed for the rest of the day. So with chills, I think my temperature got up to like 101.
Okay.
So chills, the whole 9 yards. But my thought was that I'm willing to do 24 hours of this versus getting COVID and be in the hospital. So if that is if I'm doing the weighing of the options, I'd rather do the 24 hours than something else. And then 24 hours, the next day I woke up, I was good to go. It was fine.
Yeah. People who've had COVID and had the vaccine were like, that 24 hours was nothing in comparison to the weeks of not being able to move and sleeping 16, 17 hours a day. And, so they were like, I'd take the shot 10 more times than over what I dealt with having COVID. So, and you know what they say, that's your immune system showing you that it works. I will tell you that I was like, please God, I don't need you to show me. I completely know. I trust it works. I don't have time.
I was hoping, because all of my immediate family got it. So my mom was vaccinated, my sister, my brother, my sister, all of us were vaccinated. And I think my 14-year-old niece recently got vaccinated as well, but we kept our circle close and still do. So you're not invited in my house, and I family included, unless you've been fully vaccinated. So, but I was the only person out of all those people surprising. I was the only person.
Now, I want to ask you this. Did you take anything when you got the shot?
So no, I did not. So let me back up for a second. My mom had a little bit of something, but when she called me after I had my second shot, she was like, "You sound terrible." I was like, "Thanks. No, I feel bad." But she felt a little something, but she said it wasn't as bad as what I was describing. And I did not take a Tylenol or anything. So I suggested to my husband and my sister that when you get the shot, take a Tylenol if you start to feel bad. So I did not. But out of everybody, I was the only one that had the side effect. But again, if that 24 hours was as bad as it was, it was anything like what COVID was, I'll do it again and twice on Sunday.
Well, you didn't mention any breathing difficulties. So
no,
look, so that's that on top of that, fever and not being able to breathe is COVID. So I took a Tylenol as soon as I came back from my second shot. And I don't know if it helped or not, because my sister and I had the same day and she didn't have any reaction, but I took a Tylenol because the lady told me. She was like, "You might want to take." I was like, "I will take it."
Well, see, my nurse didn't say anything to me, and so and I may not have asked either, but my husband, he got the shot the next day after the second shot the day after mine, and he was fine. So I guess it just impacted me a little differently. But I'm strongly encouraging folks to get the shot. And as I said, we're keeping our bubble was super small anyway, even before the shot, because we were really just socializing with people who had not been out. And so post-vaccine, now that the vaccine is out, I've been very clear with my family that I love you, but if you were not vaccinated, you cannot cross the threshold. And primarily just because of my son, I'm not interested in dealing with that. So.
Yeah. Now, for your practice, do you have an office that you're going to every day? And so what do you say about your clients that come in?
So I do labor. It's funny you were having the conversation with Dexter. I do labor and employment. And so a lot of the questions, and I represent management. And so I'm an HR lawyer. So a lot of the questions when COVID started, there was a lot of uncertainty about kind of what employers could do, what employers couldn't do.
Right.
So our office, we have a small office. And so we're a national firm, but our office where I am is relatively small. So we've social distance. We're supposed to wear masks in our larger office building. In our office, I think everybody's vaccinated. And so it's you're more free there. But before the vaccine, we were wearing masks and socially distancing and staying in our office. So if you came out of your office, you had to wear your mask. But I've been back since January. And it's, you know, other than the elevators to the garage and down to the lobby, I'm pretty free in terms of not wearing a mask in the office itself. And I think a lot of that has to do with the fact that everybody in our office has been vaccinated, or at least has the first shot. And so I think that makes everybody a little bit more comfortable.
Yeah.
And so, you know, just it's obviously a personal choice, but I think it just makes, particularly in Florida, and I heard Dexter talking about, we are a tourism state. And so people want to, oh goodness, sorry. People want to get out, and you can only really do that if you're vaccinated. So, I mean, I encourage the folks that are here, even though we're in a tourism state and sunshine, and it's the summer and people want to go to the beach and to the pool. If you have not gotten vaccinated, you're just putting yourself at unnecessary risk and putting the other people's lives that are around you at risk as well, when it's really just a shot. I mean, you take if you have any other type of ailments, you take medicine every day. So.
Right. And, you know, now they're telling us about this Delta variant and saying how it's even worse than COVID-19, that I said, well, this is why we really need to hurry up and get more people vaccinated before that. The last I'd heard, the numbers were 10% of the positives cases now are this new variant. We don't want to go above that 10%, so we need to hurry up and get people vaccinated, because if you understand the science of it, then you know that the more people vaccinated, the less variants will come to be. They won't be able to be created.
Right.
And that's the whole point, is that we stop this before it gets completely out of hand.
And one of the things that you said when you were talking, I don't remember whether it was Dr. Cassandra or Dexter, but polio. No one in our generation has ever, generally speaking, has never had polio because there was a vaccine.
Right.
Chickenpox. I had chickenpox when I was younger.
I had chickenpox too.
Well, I had chickenpox, but now you have a generation of young people who will never get chickenpox because there's a vaccine. And so I do understand and appreciate, particularly the Black community's hesitation and distrust of the medical community, particularly vaccines, because of Tuskegee. I get that. But when I look at the numbers and recognize how much COVID has negatively impacted our community, I just think and because we have some of the underlying health conditions that make catching COVID that much more dangerous, I think it's just more responsible for us to get it. And I think the other thing that was helpful for me, even though I didn't have an opportunity to get Moderna, if a sister is associating with the creation of a vaccine, I mean, she's fully aware. I mean, you have so many Black doctors, so thank you for doing this. You know, we have a doctor here locally, Dr. Kevin Sneed, who is the dean of the pharmacy school at USF, and he has really been, at least in our community, at the forefront of really talking to our community and answering those questions that people may have, because he recognizes historically that we do have a distrust of the medical system. So kudos to all doctors who are out there doing this, because I really want more of us to do it. So.
Yeah, and that's why Black Doctor, we've had these conversations, because we do understand that. We know, we understand, but I have to remind people that on the south side of Chicago, there was more white people in line, and I'm talking about the south side, not the suburbs, the south side of Chicago. There was more white people in line to get vaccinated because they heard that we weren't going.
Right.
So they went and got your shot.
Right.
And that doesn't tell you right there, because, you know, some people are like, oh, well, in our neighborhood, they're going to give us something else. And no. These people traveled all the way over there. And that's why they did that. And so if you figured out that they did that, then you're like, maybe I need to, that should be right there enough for you to say, oh,
Right.
if it's good enough for them, then maybe I should get in line.
Right. And
Right?
there's just so much there's just so much misinformation
There is.
out there. And whether that's intentional or not.
Well, you know what I say is you need to be careful
Yes,
who is putting out these myths.
correct.
Because they could be trying to get rid of us. I
That's
promise
correct.
you, they could be.
That's true. I agree with
Very,
that.
very, very, very careful on who you listen to
Yes.
and what you read and who wrote it, because you don't know who is for you. And if you don't understand that much, you need to make sure that you understand that little bit, that you don't know where these things are coming from. But I mean, we had somebody in office that was telling you to drink bleach. Like, come on.
Right.
And I'm so sorry that I'm not joking, but friends on the front lines were getting calls from poison control
Yeah.
that people did that. So, like I said, you have to be very careful who you listen to and who you follow and where you read, because there is so much out there that is just crazy. But you need to understand and make sure you get the information. The CDC has all the information there. People have asked, can you find out what's in them? Yes, you can. And it has been very widely spoke about that Pfizer and Moderna do contain a something that's found in laxatives. And if you have an allergic reaction to that, then yes, that would be a problem. And you probably need to get one of the other vaccines. I know Johnson & Johnson is out, and there are a couple other drug companies that are going to be releasing their vaccines soon too. You need to probably look at one of the others, because yes, you might have a reaction to that. So like I said, not everyone can take it. If you know you have allergies, then you need to check and make sure. I have allergies. I asked my allergist. He said, you're fine, go ahead. But have a conversation with a doctor and not with Google. I love Google too, but that's not the place to have the conversation. It's with your physician, so that you don't kill yourself by not taking it and then thinking everything's wonderful and walking around without a mask.
Yep. And I think to your point, I think people relying on Google MD is a dangerous thing. I think it helps preliminarily to kind of answer some questions, but if there are real questions that you have, and you have a primary care doctor or even urgent care,
right?
Go there and ask the questions, because
go to your pharmacist.
Or go to your pharmacist.
Walgreens, Rite Aid, Duane Reade, whatever. Go to the pharmacy and ask them. Yep. So there's professionals there that know what's going on. For Pete's sake, most of them are administering vaccines. Go ask them.
Yep. But people should not rely on Google MD, just like they should not rely on Google Law Firm.
I was about to say, you have a profession where people seem to all of a sudden think they're lawyers too. Exactly.
Yeah, that never works out quite well.
Yeah,
so
exactly. So let's bring everyone back on. Alexis? Okay, here they come. Okay, so you guys have all heard the conversation we're having, but Monica, what I didn't ask you is, in your community, and I know you spoke about the Kevin Sneed. He, Dr. Sneed, he's really getting very vocal about it. But do you think that access is a problem in your community?
Not that I've seen, and I think a lot of that has to do with the fact that he, along with other people, at the very beginning of the pandemic, really were advocating and speaking and accessible to people. And so when the CDC had these pop-up locations initially, I mean, people were on text message streams, and I'm an AKA, and so I know we have a lot of pharmacists in our chapter. And anytime there was a vaccine available at a particular pharmacy location, they were in the chat. I know several Greek organizations did that, and just several community organizations, and even the churches. So I have not seen an access problem. I think the challenge more so is the vaccines are available, people just going to get the shot, I think, is more of the challenge, and just kind of, we talked about before, overcoming some of the distrust and attempting to push back on some of the misinformation that people are obtaining. But I have not seen any access issues. I think that the information that's been shared by Dr. Sneed and other doctors and medical professionals in my city, I think has been very valuable, and it's helped people make really wise decisions about what they should do.
Mr. Bridgman, have you noticed anything where, any of your colleagues, even anyone saying anything about, they had family members, they were having trouble getting the access or getting to someplace to get the shot?
No, but that's and Monica, I'm your sister. You're my sister. I'm an alpha.
Hello.
So, but on the 26th of June, the state is eliminating or doing away with the pop-ups. So this problem will happen because
okay.
all these pop-ups are going to be disappearing. So now all of a sudden you're going to have these individuals having to go outside of their communities to get the shot. So this is when the problem is going to really happen. I think Florida has done a remarkable job, actually, in terms of having access to the vaccine.
Okay. But I
So,
know,
but
Dr. Esperant, I know that AHF is still going to be going into the community, right?
Yes, most definitely. We have the vaccine available, and I believe most pharmacies you can literally walk in without an appointment at this point and get vaccinated if you have
Okay.
to.
That's perfect. And that's perfect, great information to know, because a lot of people, of course, will say, well, I can't get it because I live wherever. No, you probably can. And I tell everybody the CDC is a wonderful resource. Please visit the CDC website, cdc.org. Any questions you have about COVID-19, they can be answered there. Use Google for what it's worth. Use Google to find out where you could get vaccinated in your neighborhood. My favorite thing of Google is, where can I find near me? It just
yeah,
pops up
yeah,
and
yeah,
says near me,
exactly,
right?
exactly,
So type
exactly.
in and see where it is near you and get your vaccine. And like you said, these pop-ups are going to go away, so then it might not be as convenient of a location, but you do have a week's time just about here to still
Yeah.
get it in. So please, everyone, please, if you can get vaccinated for the sake of your great grandmother and grandmother and all these, because Black people live long. So all these generations that are still living, let's keep them living by not infecting them, because I know that they want to hug you just as much as you want to hug them. So let's have the community immunity, or herd immunity if you want to call it that, but let's have community immunity and let's do this. Not to mention, Monica, 3 of us are islanders and we would like to go home. And
I'm
so
Oh,
sure.
yeah.
I'm sure. It's so interesting because at the very beginning, when the vaccine first came out, I'm from Palm Beach County originally, and I know my mom's church did a pop-up location a few weeks with that, and there were some challenges with, in terms of who was getting access to this vaccine at the very beginning. And I know the Glades area, where the need is and where there are a lot of us out there, a particular grocery store chain was disseminating the vaccines, but that grocery store chain is not in the Glades. And so there's a whole community out there that did not have access to it. Now that's since been rectified, but at the very beginning of the rollout with the vaccine, there were some challenges, I know in Palm Beach County specifically, in terms of access to the vaccine. And so that has been rectified. And I'm prayerful, to your point, that people, before the pop-ups leave, and I didn't realize that people do go get the vaccine for that very people want to travel.
right.
I want to see. Listen, I went to Florida A&M undergrad. I am eagerly anticipating homecoming. It was canceled last year, so that was another motivation for me to get the vaccine.
Right.
So there's
Must
a
be the
lot.
Orange Blossom Classic, I guess, huh?
Yes, right. Classic. There was no football last year, and I'm a huge football fan. So there's a whole lot of reasons.
Concerts, baseball games,
All of
basketball
that.
games, football games, college, all of those sports in college as well. There's so many reasons to get vaccinated. They had the first 100% full Chicago Cubs game, and every single person had been vaccinated.
Oh, that's great. That's
And then I
awesome.
know here in Michigan and Detroit, they're giving away tickets. If you get vaccinated, you get tickets to the game. So there's all sorts of incentives now. Just go get vaccinated, because
There's
we are,
absolutely, yeah.
even Madison Square Garden, I think, was testing people before you can get into Madison Square Garden. So you might as well get vaccinated.
There's absolutely no reason in the world that someone can give for not being vaccinated unless you don't want to.
Right.
And I think Monica, you had stated earlier that you have a 5-year-old home at home, and if you're not vaccinated, no one's coming to your home. No
Right.
one. I'm not inviting my friends if you're
Well,
not
you've been there
vaccinated.
and done that, so I
Yeah, yeah,
completely understand.
yeah, yeah. I
And
mean,
those that have had COVID, you can get it a second time, which is why
yes,
it's important for you to get vaccinated.
yes,
Come on,
yes.
everyone.
And I think it's very important to address everybody's concerns, right? So
Right.
you could go to your doctor's office. Again, a pharmacist is always available at
That's what
every
I said. Yeah.
corner, free consulting. Come and talk to us. We'll give you all the information you need, disseminate your fears because, we want everybody to meet everybody where they are, right? Because we want to understand them and just try to seek to understand so that potentially they could change their mind, right?
Right.
So we empower them with the information and present their risk versus benefits, and then that's how a decision is made. And you'll be surprised how many people change their mind.
Right. You're right. And I mean, when people just like there's a commercial here. There was a young lady. They said, "Why did you get vaccinated?" She was pregnant. She was 5 or 6 months pregnant, and her doctor told her it is a really good idea you get vaccinated for the sake of your baby.
What's interesting? It's interesting you say that. I have a show that I do, a video show, Wednesdays and Thursdays, and I had some doctors on last night. It comes on at 7 o'clock on Wednesday night, and one of the questions was a young lady stated that she wanted to get pregnant. She wanted to have children, and will the vaccine cause any kind of
Yeah.
any kind of problems or issues with it? And the doctor said, based upon testing, that the milk from the mother passed on to the child will, I mean, it's almost like a vaccine itself,
Exactly.
which I found to be pretty remarkable.
Yeah. And so this is why it's really important that we get vaccinated. And people don't realize pregnant women are a part of the immunocompromised as well. People don't
Mm.
realize that that is a condition. Like, so you have to realize that those women are susceptible. And that's why it's really important for them. If you ever get pregnant, they're going to say you need your flu vaccine. They're going to make sure you've had your vaccines because you could catch something because you are immunocompromised. So it's really important that we understand that all of our population get vaccinated. And especially when you have comorbidities, if you have high blood pressure, diabetes, obesity, all the things that was taking a lot of us out of here, unfortunately, in this pandemic at the beginning. Please, please. And then, of course, once you get vaccinated, can we please, and even before that, let's all be a little better with our health, just so we can all be here a lot longer. As we lost a lot of people in this last year and a half now almost,
Yeah.
that we didn't have to lose probably, but we need to take better care of ourselves. And I must say, Dexter, the reason you did not get as sick as you could have is because you're in good shape, you're in good health, and that is why you did not have to go to the hospital. But other people, weren't as fortunate. And unfortunately, that hospital stay might have ended up being the end of their lives. So it's really important that we understand that no matter how bad the side effects are for the vaccine, nothing is worse than having COVID-19.
It's the alternative.
Exactly. Nothing is worse than that. So please, if you will start with Monica, please tell people how they can find you, if you're on social media or whatever, and then we'll be done.
So, hi everybody. So, thank you again for this invitation. You can follow me on Instagram at MWHarrisESQ, or my husband and I do a podcast every Saturday morning at 11 o'clock entitled The Soul Purpose Show, and you can follow us on Facebook or Instagram at Soul Purpose Show. So, thank you so much for the invitation. This has been great.
Thank you. Go ahead. We'll have Dr. Esperano. We'll finish with the gentleman.
Thank you, everybody, for joining tonight. Go get vaccinated is definitely important. That's our only way to getting back to our new normal, right? Because there's no normal after this, right? We'll be forever changed. And you guys can follow me on Instagram at the PrEP and HIV Pharmacist. Please follow me, ask me questions, anything, because I do understand that, there's a lot of questions out there, and that the hesitancy, because even I was hesitant, but I got vaccinated and I got my little Pfizer. So now I'm a Pfizer princess and I am ready for the summer.
And Mr. Bridgman, where can we find you? And
You
your
can find
show,
me
of
at
course.
yes, on Instagram and Facebook at MIA Magazine, MIA Media Group. And this has been indeed a pleasure and an honor to be on the show tonight to actually get an opportunity to tell my story and to hopefully convince some people of the importance of being vaccinated.
Awesome. Thank you guys so much for your time this evening. And we'll see you next time on blackdoctor.org.
Good night. Bye bye.